Let's take a few minutes to review restraint documentation. I'm in the process intervention screen, highlighted on safety, risk, and regulatory. I'm going to click on document now. Isolation status is a mandatory question, so I'm going to choose standard precautions and then go down to assess restraints and say yes. This pop-up comes up multiple times. During this video, I'm just going to click OK. I won't address it every time it comes up. The first question it asks is, do you want to document alternatives utilized? We want to choose yes. Remember, the yellow boxes on the right side of your screen are there to help you, and this one says this only needs to happen once per restraint episode. Behavior risk assessment, I'm going to say my patient is violent and combative. So this pop-up comes up saying you've chosen a violent type of behavior. Are you sure? I'm going to say yes. This pop-up also comes up multiple times, and I won't address it again. I'll just choose yes. Factors affecting behavior, I'm going to say my patient is confused. Alternatives utilized, I'm going to say I decreased stimuli, I had the family involved, I picked a room close to the nurse's station, and I repositioned my patient. And were those alternatives successful? If they were, my patient does not need to be in restraint, so I'm going to say no, they were not successful. Would my patient be safer in restraints than not in restraints? Yes. Now it reminds me the second tier review needs to occur, and another nurse needs to do the second tier review. So now it's asking me for my face-to-face completed within 1 hour of the initial documentation, and all I need to do is say yes, I did a face-to-face observation of my patient. And that is required for violent patients only. Now I'm going to log out and save my documentation so my second nurse can come in and do the second tier review. My charge nurse completed the second tier review, and I'm back in my restraint documentation. In this box, you can see that my alternatives utilized has been completed, my second tier review has been completed, and my face-to-face observation was completed. So I need to do my application documentation. So I'm going to click yes, and again, this also only needs to happen once per restraint episode. So it's asking me the time and date the restraints were applied. I'm going to say today and now. The restraint device, I'm choosing the quick release, bilateral upper extremity. Safe application and least restrictive verified, yes. And response to restraint, our patient was tolerant. They were a nice patient today. Restraint notification, we discussed this with the patient and the family. Now it's asking for my safety and dignity maintained and verified. This needs to be documented at the end of the shift, as this documentation is done on paper. So it's just asking, have you been doing this every 15 minutes? So we're going to say yes. Now we're doing our document restraint status monitor. So this needs to happen every 2 hours in the room with the patient. I'm choosing yes. My patient is not off the unit. Their behavior is still combative. And the restraint device is still the quick release. Bilateral upper extremity. Did I observe that the restraints are appropriately intact? Yes. Response to restraint, my patient is still tolerant of them. And did I use any further alternatives? So I'm reorienting my patient and continuing to include the family. And my patient is awake and alert. Then it's asking me if restraints are within defined parameters, and this yellow box gives you all the defined parameters. I'm going to say yes. The next section is document RN, assess, and discontinue. This should be done throughout your shift. You want to monitor to see if the patient should be removed from the restraints. This needs to be documented at least at the end of your shift and more frequently if needed. So we'll go in and do the documentation. My patient is not off the unit. I assess them. My 15-minute checks have been completed. I reviewed the reason for restraints with the patient and the family. And I reviewed criteria for release of restraints with the patient and the family. My criteria was not met. Now I'm filing, and that's the end of the restraint documentation.